Season, or as the CDC is now calling it, respiratory illness season, is here. Health officials are now including COVID-19 and RSV along with influenza this season.
The Lexington-Fayette County Health Department says these three respiratory viruses are expected to circulate in the community. WKYT's Grayson Passmore and photojournalist Darnell Crenshaw speak with the Lexington-Fayette County Health Department spokesperson Kevin Hall on how vaccinations not only protect you but also your loved ones.
The CDC's forecast for the upcoming fall and winter respiratory disease season is expected to be gloomy. Health experts believe this season will have a similar number of hospitalizations compared to last year. In December of 2022, hospitals across the nation were more full than at any point in the pandemic. And Lexington had the confirmed cases to prove it.
Lexington had more than 3,500 lab-confirmed cases. It's the most we've ever received here in Lexington.
Kevin Hall with the Lexington-Fayette Health Department emphasizes those were just lab-confirmed cases.
And that's just the tip of the iceberg. Those are just lab-confirmed cases, not the rapid tests that most medical providers use.
But now, two other respiratory viruses have the attention of medical providers, COVID-19 and RSV.
Just because COVID's not out in front and leading the news every night doesn't mean it's not still out there.
Hall says the health department is currently seeing 150 to 180 cases of COVID-19 a week, and those are only lab-confirmed cases.
Think about it like the flu shot. You get a flu shot every year, you need the COVID shot now every year. It's recommended to go ahead, get both shots at the same time, one in one arm, one in the other.
The RSV vaccine is available as well. Check with your doctor. That vaccine is recommended for people 60 years and older, as well as young children. Hall says getting vaccinated not only protects yourself, but other family members living in your household.
Think about the people who have young children or elderly members of the family in the household. They are the people at highest risk, so getting the shot to keep you safe also helps them.
In Lexington, Grayson Passmore, WKYT.
And Hall says in some cases you can get all three of those vaccinations at one time.